Congratulations, Radyo Agila. Mga bagong kaalaman sa siyensya at teknolohiya. Alamin sa programang Pinoy Scientist. Tuwing linggo, alas 5 ng hapon hanggang alas 6 ng gabi. Pinoy Scientist. KBP Best Science and Technology Radio Program. Pinoy Scientist. Dito sa Radyo Agila.
Good afternoon. This is Dr. Guido David on DZEC 1062 Mega Manila, Net 25 Eagle Broadcasting Corporation. So, happy Sunday. It's May 7, 5:01 p.m. Ako si Dr. Guido David. Kasama ko si...
Ako po si Doc JD, bumabati mula dito sa San Pablo City, Laguna, Barangay San Vicente. Yan, kinumpleto ko na po. Nandito po ako ngayong araw ng linggo at syempre mainit po talaga ang panahon. Ewan ko dyan sa Quezon City, Doc Guido, how is it there?
Nako, sobrang init. Andito na yung ating guest pero kakusapin natin siya mamaya si Dr. Butch Ong. Pero mamaya tatanong din natin tungkol dito sa heat wave, kung ano yung mga dapat gawin natin para maiwasan natin ang heat stroke. Pero may mga gusto ka bang batiin, Doc JD?
Oo, kagagaling ko lang doon, nagmerienda ako. Okay, tama. Yung kaklase ko ng elementary na si Miss Lucy Bueno Cruz ay nag-birthday ngayon sa San Antonio, San Pablo City. Malapit lang na barangay. Sa elementary ko po siya kaklase at may birthday din si Miss Luella Brion. Sa masteral ko naman po yan sa Lasal. At mamaya pong hapon na mga alas 6 ay magkikita naman po kami na high school friend ko na galing po sa ibang bansa. Mayroon kaming mini get together, mga kaklase ko sa high school ng Laguna College. So nagpapasalamat ako kay Grace sa Bartolome Alina sa pag-imbita sa akin. Ngayon lang siya ulit umuwi. So, yan, shout out mga kaklase ko sa high school. Magkikita kami mamaya. I think we are 15. O, diba? That's very happy. Happy occasion.
Happy occasion. Ingat-ingat lang dahil, syempre, alam mo naman.
Mag-face mask, maglalahat. Syempre, same, safety precautionary
Safety
measures.
protocols. Yes.
Ako
naman,
teka muna, Doc, yung aking mga lagi, yung kapag ka po ang atin pong programa ay, yung tungkol sa salitang Tagalog, balikan para di malimot. Marami pong sumasali dito at ito po ang mga panalo sa atin pong laro. Si Demet Quasay, si Sally Ibarra, Romeo Lopez, Malay Dizon, Pednat Natural, Lucky Chan at Mel Pesinacheng. Pasensya na po, marami akong bate kasi may laro. Salitang Tagalog, balikan para di malimot. Back to you, Doc Guido.
Yes, ako batiin ko lang belated happy birthday mga recent birthday celebrants kasama si Dr. Custer, yung ating co-Pinoy Scientist din.
Ikaw din. Birthday mo din.
Si Dr. Michael T, yung aking niece, si Barbie, sister ko si Abby, and then friend ko si Pat. And then yung mga iba pang may birthday na hindi ko nabati si Nabinel, etc. Also sa from Twitter, ito yung mga nagpapagreet. So si Pinoy Go, Alex, Meteorologist, Planck Epoch, Raya 2.0, I am Negatron, Gigi, Lay Sanpi, Frenel, Manuel Texon, Joyce, Braille Gonzalez, Joff, Bing Salvador, and si Jet. So, ayun, Doc JD, so ready ka na ba sa iyong tula para sa ating guest?
Siyempre, inspired. Alam mo naman, si Dr. Butch. Sino hindi nakakakilala kay Dr. Butch? So, ito po ang titulo. Tama ito, kung okay na ito. COVID-19 pandemic. Tapos na nga ba ang emergency, di ba yon? Emergency status niya. So, ganun na lang po. ang context ng ating paksa ngayong hapon. At ito po ang tula na alay po namin kay Dr. Butch. Sa hapong ito ay tatalakayin. Ang paksang sa kasalukuyan ay problema pa rin. Kahit pa humupa na ang bagsik kung iisipin, patuloy pa rin na talagang suliranin. Matatanda ang 2019 nang nagsimula itong coronavirus na nakakahawa hanggang sa buong mundo ay ideklara, sabi ng WHO ay global emergency na. Kaya ang Pilipinas ay nagpahayag na rin na sa state of emergency ang bansa noon dahil sa COVID-19. Yan ang ipapaliwanag mamaya sa atin ng panauhing bihasa sa ganitong usapin. Ang panauhing naririto na sa Google Meet si Dr. Rodrigo Butsong at sobrang mabait na imbitahan ngayong linggo na dapat siya ay rest. Pasasalamat sa kanya, ang sa tulang ito ay lakip. Kaya tumuto kayo sa kanyang mga paliwanag. Isa siyang manggagamot at bilang fellow ng Octa Research Group ay tanyag. Sabihin na natin siya ay talaga namang sikat, konsultant sa kalusugan, kaya hahangaan ng lahat. Dagdag niyang posisyon ay sa PITAC, Philippine Institute of Traditional and Alternative Healthcare at masipag, sadyang nananaliksik at maraming publikasyong naihayag, dedikasyon sa pagtulong ay hahangaan nating lahat. Sa huli nais nating idiin dito sa talakayan na marami na rin tayong mga karanasan dito sa COVID-19 na di natin inaasahan, kaya tulong-tulong tayo sa patuloy na paghahanap ng permanenteng kalutasan. Salamat po, Happiness. So yan po ang tula ko and back to you, Doc Guido.
Salamat.
Happiness.
Happiness, salamat Doc JD at magbabalik rin ang Pinoy Scientist after these few reminders. Thank you, Doc JD.
Ang oras na ito ay hatid sa inyo ng Cable Link, your link to a world-class entertainment.
EBC, Eagle Broadcasting Corporation. Ito ang Radyo Agila. Mga bagong kaalaman sa siyensya at teknolohiya. Alamin sa programang Pinoy Scientist. Tuwing linggo, alas 5 ng hapon hanggang alas 6 ng gabi. Pinoy Scientist. KBP Best Science and Technology Radio Program. Pinoy Scientist. Dito sa Radyo Agila.
Welcome back to Pinoy Scientist on Radyo Agila DZEC 1062 Mega Manila, Sunday, May 7, 5:08 p.m. So ito ang Pinoy Scientist. Ako ang inyong kapanayam, Dr. Guido David. Andito na yung ating host, yung ating guest. Pero before that, ang pinakabalita nung May 5, WHO ends global health emergency declaration for COVID-19. So babasahin ko lang ang saglit itong balitang to. Ayon sa NPR, the World Health Organization has lifted the public health emergency of international concern, or PHEIC, for COVID-19. In a press conference on Friday, Director General Tedros Adhanom Ghebreyesus said COVID-19 has been so much more than a health crisis, disrupting economies, travel, shattering businesses, and plunging millions into poverty. He went on to state that for more than a year, the pandemic has been on a downward trend. And this trend has allowed most countries to return to life as we knew it before COVID-19. Then he made the pronouncement, therefore, with great hope, I declare COVID-19 over as a global health emergency. He also spoke of the painful lessons we have learned, emphasizing that the investments we have made and the capacities we have built must not go to waste. We owe it to those we have lost to leverage those investments, to build on those capacities, to learn those lessons, and to transform that suffering into meaningful and lasting change. One of the greatest tragedies of COVID-19 is that it didn't have to be this way. The end of the emergency declaration comes more than 3 years after Tedros announced it on January 30, 2020. At the time, there were fewer than 10,000 cases of the virus, mostly in China. Nearly 7 million deaths from COVID-19 have been reported to WHO. More than 1 million of the deaths were in the United States alone. But Tedros emphasized that we know the death total is several times higher, at least 20 million deaths. Here in the Philippines, we have, according to DOH, we have 66,453 deaths. But when we look at the data from the Philippine Statistics Authority, we have more than 100,000 COVID deaths. Some reported as COVID, some without testing, but presumably from COVID. So the death toll is, 100,000 is what? That's about 0.1%. That means one out of every 1,000 people, Filipinos, died from COVID. So to dissect this itong matter na to, I welcome our guest, Dr. Butch Ong, Dr. Rodrigo Angelo Ong from PITAC and also from Octa Research. Good afternoon, Dr. Ong.
Hi, Guido. Good afternoon, and good afternoon also sa listeners and to the viewers of Pinoy Scientist program.
Maraming salamat for joining us, Dr. Ong. So we want to make sense of this pronouncement of WHO. So what does it mean for us, itong pronouncement? What does it mean for the everyday Filipino?
You know, Guido, mula nung Friday, May 5, I've been getting a lot of messages, a lot of questions, especially from my network, even with the medical or the healthcare field. No? Is the pandemic over? Is the WHO saying that the COVID-19 pandemic has finally ended? Well, if you dissect closely what the press briefing really gave on the messages, is that number one, WHO does not actually declare pandemics. I just learned about that on Friday, and it is not within their purview to declare a pandemic and to end the pandemic. No? So the declaration was in the COVID-19 is no longer a public health emergency of international concern. No? So this message means that we should already focus on other issues that has been left behind, especially medical issues. No? I'd like to give an example, Guido. No? One, the polio, measles vaccination program has really taken a back seat, for the last 2 or 3 years because of COVID-19. No? And most recently, we have the Chikiting Ligtas program of the Department of Health, wherein the catch-up immunization is now being coursed through all the regions. No? So it means that the focus should not only be now on COVID, but also now on other factors which have taken a backseat in these last 3 years.
Yeah, and to be fair, siguro the focus was not all on COVID, pero I agree. I think especially in 2020 when the pandemic just started, and then 2021 when it was still at its peak, the focus was mostly on COVID, and a lot of people were not able to access healthcare. And worse than that, yun nga, yung vaccination for some of these other diseases you mentioned, like polio and measles, nakaligtaan na. And right now, I mean, of course, may heat stroke, but there's also dengue waiting in the wings again, which could be another public health threat in the Philippines based on historical data. Nakikita natin every rainy season, we'll see a dengue wave. Pero so I asked what it means for the everyday Filipino, Dr. Butch. So it means that you're saying na hindi naman sinasabi na the pandemic's over because they don't have the capacity for that. But the global health emergency is over. What does it mean in terms of yung mga policies natin? I know siguro from kasi this covers a wide range of areas eh. And that's why we're trying to dismantle everything that was said. Um, and you're saying na from a health perspective, hindi naman siya na COVID will take a backseat, but it will be viewed in the same level of importance as other diseases. Parang ganon. Parang,
That's correctly though. No, if you look at the situation in the paradigm of disaster science or disaster medicine, where you have your when there's the occurrence of the disaster, you have your disaster response. After the disaster response, you have disaster rehabilitation. Then after rehabilitation, you have your disaster mitigation, and then after that, preparation. So I personally, I believe that from a reactionary uh, portion of disaster science, we now go into the other areas of disaster science, which is now going on the preparation, the mitigation, and the rehabilitation phase. So at this point, the WHO does not really say that that COVID-19 is no longer a threat. In fact, part of the statement is that it is still very much a global threat, and they mentioned that the situation could have spikes every now and then. No? So they are saying that COVID-19 is here to stay. That COVID-19, the SARS-CoV-2 virus, will mutate and will cause spikes along the way, but they are confident, I believe that's what they said, that the systems are in place already to react to the spikes, no, and to mitigate effects not only on health but also in economy. No, I think what we where we are now is in a very critical mode. No, because there are a lot of misunderstanding about the statement of the WHO. The cases are still increasing. I believe the latest of the reports say that in NCR it is increasing, and the national and the number of cases nationwide is also increasing, but in increments, not like the Omicron wave in 2022. No, it's not like that. It's increasing, but I think in any disease entity or any disease, no, it is expected that there are seasonal increases or spikes, no, depending on the situation. For example, for rainy season, of course, you would expect dengue to be the predominant illness, no? And for the non-communicable disease, this summertime you have your heat stress and heat stroke and the so we now I believe go into the rehabilitation phase and the disaster prevention phase, no? So that whenever the next pandemic comes in, we will be prepared, no? And it will not cause the havoc that it has caused in the last 3 years. I think I think that's the gist of their message.
okay. And well, you mentioned some systems in place. And I think the WHO reminds us na we should keep these systems. And in fact, well, maybe we can think of it na not just keep it, but maybe strengthen these systems. And ito mga lessons learned, we will build on that and not move on na parang, okay, tapos na, um, we don't have to focus on that anymore. So ano itong mga systems na to, Dr. Butchong?
The first system I think that they mentioned was in the detection
Mhm.
of COVID-19, which are of course what we know now as you have the clinical detection, wherein the symptomatology of COVID-19 is is laid out. And then a lot, if you remember before in 2020, in 2021, no, we only had loss of taste, loss of smell, fever, no, shortness of breath, no, and then when the other variants came along, we now had diarrhea as part of the symptomatology, and
Even
later
sore
on,
eyes. Yeah.
now, yeah, it's all right. No? So that's the first one. No? So we were able to get that because of published reports. No? So it's still important to publish, no, observations from around the world, no, and to track these publications so that we are abreast of what symptomatology COVID might present. The second one is in the technologies of detection. We have the RT-PCR, of course, no, as a gold standard, and after that, the rapid antigen testing. Actually, it was the rapid antibody testing first, and then rapid antigen testing. No? So there were a lot of technologies developed. No? The next one is the development of vaccines. No, we have different platform for the vaccine. No, we have the attenuated vaccine. We have the viral vector vaccine. We have the mRNA vaccine. So apart from that, we have the treatment. No, so we have a combination already of several treatment modalities for COVID-19. No? We have molnupiravir. We have remdesivir, and for even for traditional medicine, Guido, no, I believe it has played a big role also. No, a study done at the University of the Philippines showed that lagundi was effective for the symptom of shortness of breath. No, tsaka yung cough.
Sorry, ano nga ulit yung Lagundi, if I may interrupt?
Lagundi is Vitex negundo. No, it is used for asthma. No, it is commercially available in the botica, no, for asthma. And during the pandemic, the UP Manila, no, discovered, or they did a clinical trial on Lagundi and found out that it was effective in reducing the symptoms. So not the viral load, but the symptoms of COVID-19. So it has helped a lot also yung ating halamang gamot, which is Lagundi. No? Another system, of course, is in the community mobility restriction. No? It's very controversial, yung mga lockdown, mga quarantine. No? But it has been a part of our history. No? And we have controlled the transmission of SARS-CoV-2 in the communities through that modality. So all of these systems that I have described, we have all gone through them, as not only as a country, but as globally. All the other nations use these modalities to control the transmission, to control the severity of COVID-19. And those are, I believe, what they were discussing about the systems in place. No? And one more system, which I think is very important, is in the data analytics. No? We have the Our World in
Our World with Data, yeah.
Our World with Data, no, which is an open access portal. We have the Department of Health publishing daily reports about COVID-19. And of course, we have Okta, no, also publishing data every day, and not only in publications but also in social media platforms. No? And this has helped our countrymen be abreast of what is happening, no? So that they can be proactive themselves. No? Even until now, we see people still wearing masks because they know that cases are rising, and they are more vigilant and they are more careful. So those are the things that I think will be the new normal, no? As we go into the ayoko sabihin post-COVID era, wala pa tayo doon because cases are still rising. No? But I think that is what we should be preparing for the next few years. These are the necessary steps that we have to address. And before yung isa pa, yung brain drain natin palagi ito, yung lack of nurses natin, no? na ng mga doctors natin na nag-abroad, no? Dahil they find greener pastures abroad. No? So yung that also has to be addressed.
Yeah, and that's unfortunate. On the one hand, parang I'm happy for our kababayans na becoming OFWs, finding employment that will make them gainful. On the other hand, syempre, nakakalungkot. I mean, because we have to address this. And, how we address that firstly is, obviously to provide increased benefits for our kababayans, for our healthcare workers, so that they have some incentive to stay here. I mean, alam ko hindi naman natin match yung salaries abroad, pero if we can make it competitive, um, then at least there will be some retention. I mean, any work naman, essentially, you will make more abroad. Pero if you just make enough na you can, you can comfortably live here in the Philippines, I think that would compel some to stay. Now, regarding some of your points, one, I know yung mRNA vaccine, mRNA technology is very new, right? It's something that was not available before, and there people think that it could be um, not replicated, but the technology can be used for other types of diseases. Um, Another I want to point out or mention, um, since you're talking about alternative medicine, and I have to mention this because I'm transparent, and I am, we listen to all sides. How about yung ivermectin, wherein there was initially some support for it as an alternative medicine?
Guido, in the discovery of science, no, discovery of technologies to solve a social issue, no, on health, no, like COVID-19 when or NCOV pa dati, no, NCOV-19, no, this is such a novel disease. We did not have any drug or any medication or treatment modality specifically for that NCOV, no? But later on, we did develop some technologies like the mRNA vaccine and some other medications. No? In the discovery of solutions to these problems, so it is actually expected that we will search for technologies which we have now, which we can use for that new health threat. No? And one of those was, yes, you mentioned ivermectin, and there's another one, the
There,
hydrochloroquine or
there were
chloroquine.
others, right?
Yeah, no. There was even
Yung
talks
mga
about,
plasma
yeah,
treatments or something.
yes, no. Meron pa nga mga high dose vitamin C, use of zinc, no. But these are supplements and these are
How
all
about
vitamins.
extra virgin coconut oil? Ayun, I was hearing about that.
Yeah, in the extra virgin coconut oil, actually, there were studies which backed up the use of virgin coconut oil for the symptoms of COVID-19. No? So that was, I believe, in 2021. No? And it also coincided also with the discovery of Lagundi as effective modality for COVID-19. No? But these are normal occurrences, you don't know, when we have technologies already present, which in theory can help solve the problem. No? But although these are in theory sound, no, theories, no, we must put them to the test. We must put them through the scientific method, no, and do a clinical trial to see if they are effective. No, although they might be safe, no, much like in Lagundi and virgin coconut oil, we know that they are safe, but they went through clinical trials as well. As for the other components, the ivermectin, no, and the chloroquine, no, I believe that the published results from other countries also had biases, no, which kind of eliminated its use for any meta-analysis. No? So, but during that time, we already were discovering the benefit of molnupiravir and remdesivir already. So we did not need to go back to the use of ivermectin and hydrochloroquine or chloroquine. So we already had treatment programs and modalities already available to the public. And we did already have our vaccination program already at that point. So, gano'n nga actually Guido, no, sa pag-solve ng problema in health, no, and we already have current technologies to solve in theory, no, or hypothetically, no, they may be used, but they also have to be put to the test, no, para for public safety ito, no, to determine if it is really safe, if it is really effective.
Yeah, I was wondering, Dr. Butch, since you're, a research specialist at PITAC, which is, about traditional and alternative healthcare, right? And so, in a way, I was not surprised that you mentioned Lagundi. Pero I was surprised if initially, or I was wondering if initially these were being considered yun nga, as alternative healthcare. And I suppose the answer is, in a way, yes, you consider them. Um, but of course, you are science based. So you weigh the evidence. And sometimes you're right, diba? It's difficult to parse through even the studies. Some of them will have biases for and against. May mga parang favorites sila eh. And we know that when you have a study, I mean, technically science should be objective, pero it's not out of the realm of of possibilities. Now you can inject some bias, especially when you're dealing with data and statistics, because sometimes hindi naman you could manipulate the data, but um, it can show um, different stories, di ba? Tama ba, Dr. Butch?
Yeah, actually, yung there are many stories which came out in the use of many alternative drugs, no, in COVID-19, no. Um, I remember there were a lot of inventors, no, na yung iba hahawak ka lang ng 9-volt battery, mawawala na daw yung COVID-19. No? I recall those, no. But there are others na bleach, no, iinumin, no, para
Yikes.
yeah, I recall, no, and of course, no, the general public, no, naghahanap talaga yan sila o tayo ng lunas para sa misteryong sakit na ito, no, but patama ka, we must rely on science, we must rely on reason, and we must rely on data, no, even if it is theoretically plausible, no, to use a certain modality for a novel disease. No, we must still subject it to the test, no, to the scientific method, and that has been the way of medicine. No, we have developed antibiotics, we have developed antiviral drugs, we've developed a lot of treatment modalities through science. No? And there were also a lot of questions, no, kung bakit yung paggawa ng vaccine normally takes 10 years or 15 years, no? Pero ngayon, nagawa lang in less than 2 years. If you recall, the mRNA, parang ang dami nagtatanong, no? Um, there are a lot of, let's just say, developments in science and technology, which actually enables the fast tracking of the development of medications, no? What is the rate determining step actually is the clinical trial. So we have to have hundreds or even thousands of cases, no, to determine if the modality that we have chosen is safe and effective. No? But in the case of the vaccines, no, we have seen naman that the vaccines were actually effective in lowering the severity of illness, no, of COVID-19. Of course, to stop the transmission and to slow down the transmission, we have the wearing of masks, we have the social physical distancing, we have the staying at home when you're ill, diba? But when you combine both, no, we are effective in reducing the severity and the number of cases in the community.
Yeah, thank you, Dr. Butch Ong. We will pause for a station break, pero when we get back, we'll have part two of our discussion with Dr. Butch Ong on the COVID health emergency that the WHO has declared has ended. So we'll be right back after these few reminders.
EBC, Eagle Broadcasting Corporation. Ito ang Radyo Agila.
Paano ba maging positibo ang pananaw sa gitna ng pandemya? Una, baguhin ang mindset. Huwag na nating asahan na babalik sa dati. Dapat i-embrace ang new normal. Pagtuunan ng positive thoughts and blessings na natatanggap natin. Sabi nga, every gising is a blessing. Pangalawa, maging matapang sa pagharap sa new normal o sa pandemya. Bakit kailangang matakot kung sumusunod naman sa health protocols? Malakas ang immune system at prayerful tayo. Pangatlo, paglayin natin ang attitude na goodness, kindness, at mindfulness. Samantala, nakakatulong din ang pakikinig ng musika para mabawasan ang stress. Ilan lamang ito sa mga paalaala para maging positibo ang ating pananaw sa harap ng pandemya.
Mga bagong kaalaman sa siyensya at teknolohiya. Alamin sa programang Pinoy Scientist. Tuwing linggo, alas 5 ng hapon hanggang alas 6 ng gabi. Pinoy Scientist. KBP Best Science and Technology Radio Program. Pinoy Scientist. Dito sa Radyo Agila.
Nagbabalik ang Pinoy Scientist on Radyo Agila, DZEC 1062, Mega Manila. Happy Sunday, May 7, 5:37 p.m. Ako ang inyong host, si Dr. Guido David. So this is part 2 of our discussion with our special guest, si Dr. Butch Ong of PITAC and also of Octa Research. So fellow ng Octa Research. So before I follow up with questions kay Dr. Ong, magbabasa lang ako ng konting statistics. So as of yesterday, medyo mataas yung na-report ng cases, 1,878 nationwide. The 7-day average has increased to 1,258 from 528. So parang nag-double, more than double yung number of cases. And in NCR, yesterday, 807 new cases reported with a 7-day average of 543 from 210. So, but more than double din yung tinaas sa NCR. And the positivity rate increased from 16% to 22% in NCR. It looks like tataas pa siya. Of course, dapat, I mean, with the state of emergency being ended internationally by WHO, number one, tatanong natin kay Dr. Butch Ong, dapat ba kalimutan na natin itong mga numbers? And secondly, itatanong din natin, should we be alarmed or concerned by this rising cases sa Metro Manila? Pero bago diyan, I should also mention na tinanong ko sa Twitter on my Twitter unscientific survey, i-share ko lang, although hindi pa tapos yung Twitter survey na tinanong ko, pero malapit nang patapos. So far, 981 votes. The question was, with COVID state of emergency being declared as ended by WHO, should the DOH stop tracking COVID data? Yes, 27.5%. No, 67.8%. So I don't know or I don't care, 4.7%. So majority, about 2 out of 3, 67.8%, sabi, the DOH should continue to track COVID data. Uh, what say you, Dr. Butch?
Well, that's actually quite encouraging that a lot of people would like to continue the data analytics and the data reporting, no? Because it is really, it has been part of our daily habit ko na rin yan, tumitingin din sa numbers, no? It has guided many of our, not only ordinary citizens, no, but businesses, no? In many businesses which I know of, no, kapag tumataas ang cases, automatically they go on this mode, no, which they have parang skeletal forces already on the standby, no? And this is actually part of what the WHO has been saying, or has said, no, last May 5, no, that systems in place must continue, no, and a part of those systems is actually the reporting, no, and the analytics of the data. So I believe that I am actually encouraged, no, by the report of your unscientific survey that there are a lot of citizens, no, who look look at the data and are quite objective enough to interpret the data themselves, no. And I think that has been the success also, no, of data analytics over the last 3 years, no, yung big data, no, and citizens have actually appreciated what big data can do, no. It can actually reduce pandemics, no. It can stop transmission, no. It can save lives, no, and that's something that we have not heard of before, no. That big data can be used, no, in health, no, especially in the scale of the COVID-19 pandemic.
Yes, thank you, Dr. Butch. On the flip side, meron naman those who say na, okay, so since we're fair, we'll look at all sides. Meron mga nagsasabi na, bakit pa tayo tumitingin sa data? Of course, like I said, the majority, 2 out of 3 feel na we should continue to collect data. Pero yung mga dun sa 1 out of 3, may mga nagsasabi na, why do we still have to collect data? Hindi naman tayo nagko-collect ng data sa flu, for instance. I mean, do we collect data flu? Do we report, ito yung number of flu deaths every day, ito yung number of flu, or nakakuha ng flu every day or every week. May mga iba pa nagsabi na parang OA na daw yung tugon natin sa COVID because yun nga parang nung umpisa naiintindihan na lang, pero ngayon parang after 3 years na parang ganito pa rin, parang I guess some people want to move on from the COVID mindset and parang back to normal life, which is in a way understandable. Parang may mga COVID or may mga pandemic fatigue. I mean, not saying that it's still a pandemic, whatever it is, epidemic or COVID fatigue. So ano yung mga masasuggest mo or comments mo, Dr. Butch?
Well, we have always actually tracked several diseases, no? Like measles, tuberculosis, even HIV. No,
Yes.
we do have numbers for those. No, and I believe that since COVID-19 is such also a novel disease, no, that we should also track it. No, there are published reports already of what we call long COVID, no, which means you have already hurdled, no? So ano ka na, asymptomatic ka na, you're free of the disease, no? But you still have symptoms of it, like fatigue or brain fog, no? Or sabihin natin na walang gana kumain, or even in many cases, actually, mental health, no? So I believe that for a while, no, siguro dapat we should still look at the numbers, no, dahil it still poses a threat, no. And alam mo, one of the things that I have been really advocating for the last 2 years, is the effect of COVID on mental health. No? as both as professors tayong dalawa, we know that the student body is actually quite vulnerable also, no, to anxiety, depression, and mental stresses, and it can affect their learning, no. So because of all these factors, no, I think we should still keep track of the numbers, no. Hindi naman, being safe and precautionary, no, I believe it's a prudent way to even exit a pandemic, no, that we should also still keep what we have learned in the past, no, to have that safety mindset, to have that precautionary mindset, no, para hindi maulit yung nangyari sa atin noong 2020. So if ever, no, siguro we should understand that the data coming from all these illnesses, measles, tuberculosis, HIV, COVID-19, no, will be used actually for public health policies. No, if we stop counting the numbers, then there will be no policy drafted. No, kasi walang basis, walang reference. No? So for us to move into the new normal, we need data. No, we need a basis for which we can make good policies to protect our citizens.
And not to mention yung mga advisories, Dr. Ong, like, and I believe we do track dengue cases, but I think yung systems natin that we built over the past 3 years, I mean, we should be more proactive in counting dengue cases because I think before the COVID pandemic, yes, we hear na dumadaming dengue cases, pero there was not much awareness about it. And even yung other diseases, hindi naman natin sinasatabi sila. Yung cardiac diseases, cancer, I mean, these are on the rise recently. So definitely, but there's also some concern internationally because according to some of the organizations, I think yung CDC or other U.S. Organizations which are involved with the data tracking, some of them will stop collecting data, and some experts globally are concerned about that. Now, and I think if we have the systems in place, I mean, we don't have to do anything. Parang it will just continue tracking, and it's not naman to alarm people, but just to inform people. At least yun yung my opinion. I might be biased dahil I mean, alam niyo naman, ako yung involved in sa reporting of the data. But that's my opinion na if people don't want to know the data, then they can just turn it off. Diba? They can just go on with their life. Okay, everything's back to normal. But for some people, especially mga seniors and yung may mga comorbidities or those concerned with some of the long-term effects of the virus. Or, I mean, ikaw ba, Dr. Butch, would you like to get flu if you can avoid getting flu? Ako, I would like to avoid getting flu if I can avoid getting flu. And ganun din with COVID. It's not about COVID per se, but the other, even other diseases. Who wants to get dengue, diba? So we advise people, to avoid getting dengue. I have some quick questions. I don't know kung from our viewers. Ito medyo, I don't know if you can answer that, pero I will read it. Sino magbabayad sa pang-hospital at panggamot ng mga magkaka-long COVID at sakit na bunga ng COVID kung wala na daw tayong tracking or something?
Well, actually, that the answer kanina, no, points to that. No, if we don't have data, then we cannot make good policies, including that one. No, it is possible, no, that long COVID can be covered. No, but it has to have data. No, we have to publish so that the kunyari, yung PhilHealth, no, can include it or in the universal healthcare system. No? So, kaya ako, sa tingin ko, kailangan pa din na i-continue yung ating monitoring, no, at least, no, and analytics.
Okay, and of course, pag sa Twitter ko, marami dito mga hindi masyadong impressed with the vaccine. So I just have to mention this, and because we're fair, do we track and monitor mga side effects of vaccines? I mean, I believe we do. Um,
Yes.
and we do parse through that data. Tama ba, Dr. Bochong? I mean, we are transparent naman with the vaccines. We don't, sa alam ko, we don't, I mean, people don't cover up the, yung side effects or kung may data man nito, right?
Yeah, that is part of the surveillance of any drug. Actually, not just vaccine, no, of any drug, especially any novel or new drug, no, that even adverse reactions are monitored and reported, of course, to the regulatory agencies of their country. In the case Pilipinas with the FDA. So it's actually part of the system also, which was discussed by the WHO kanina.
And based on your tracking, do you see anything noteworthy that should be reported? Ako, I don't look at the data in close detail. I've looked at it. I've looked at the FDA data, and but I just want to get your opinion about it, Doctor Ong.
Well, I can only speak of my professional practice. Now, of course,
Mhm.
I've had patients who had their vaccination and even boosted. No, and all of them actually only report mild no, cases. There was a couple of cases, I believe, that had allergic reactions like rashes, no, but quickly subsided when we gave anti-allergy medications. Of course, the most common is fever and body pain. No? That's as per my practice, no? But in literature, of course, no, there are other cases which were reported, no? So transparent naman din yung reporting of these cases sa regulatory bodies of the countries involved with the vaccination.
Yeah, so you're saying these are reported naman, and we can't deny there are some
Correct.
adverse effects,
Correct.
like because if I mean, correct me if I'm wrong, but any drug or intervention will have a certain percentage of adverse effects. Kumbaga, I don't know of any medication
Mm.
or vaccine that will be 100%
Yes.
walang adverse effects, right? So it
Yes.
is part of, I mean, some people would just react differently because we're all human, but we are also built differently. And some people may not take that well. The important part to note is that how much of our population will be affected by these. And based on what you're saying, you're not seeing a significant
Or there are,
percentage
yeah, or there are no serious adverse reactions.
serious
So,
adverse.
yeah,
Okay. So may mga adverse like rashes and such
fever,
type, but
yes.
you haven't seen any serious adverse effects.
Not in my professional practice.
Okay, fair enough. So we're almost out of time. I've covered the questions. So I think I covered this one. Ano ang importance na WHO announcement to ordinary people like me? I think we covered that in the first part, Dr. Ong. Pero so what would you be your message if we could have a few minutes to close your argument? We end at 6 para sa mga listeners and viewers natin, especially yun nga right now, the global health again, the news is that WHO said that the global health emergency has ended, um, but COVID is here, still here. And in fact, we're seeing a rise in cases, and I've seen some memos. There's a memo from Quezon City to advise the public to, protect themselves. You know, that includes wearing of face masks and other health protocols. Hindi naman mandatory, but they're just giving some advisories and for businesses to take certain precautions. So what could be our and you did mention, Dr. Ong, na this is something that we will come to expect. It will be part of our normal. Cases will rise, cases will drop. There will be times na we will inform the public if the data is there na cases are rising and people will need to be careful. And then there will be times that we will tell them, cases are decreasing or cases are low, positivity rates low, less than 5%, you know, um, basically things are all good. Um, so what would be your parang message to our kababayans who are looking for guidance, especially from noted health experts such as you, Dr. Buchong?
Siguro Guido, no, as we will just talk about the Filipino culture, no. Tayo mga Pilipino talagang mahal natin ang ating pamilya, mahal natin ang ating mga ang komunidad natin, no. And to protect our communities, we already know what to do, no. We have the data to base our precautionary measures from, no. We have our voluntary masking, which I think I still see people wear masks even indoors or in outdoors. So the mindset of the Filipinos is actually a mindset of safety and precaution. No? So let us keep that, no? And magbayanihan tayo. And as I have said, even as early as 2020, no? As a nation, as a culture, magbayanihan tayo and we can end this pandemic together. So siguro all of that taken, no? Even with the WHO pronouncement of the na hindi na public health concern of yung COVID-19, no? It is still very much a threat in our country right now, and we know what to do. And as Filipinos, I think, no, it's best na magbayanihan tayo at this point in time para agad-agad natin na matalo itong COVID-19.
Well, thank you so much, Dr. Butch Ong, for being our guest, and thank you for your time and sharing your expertise and your knowledge to us. So again, happy Sunday. This is May 7, 5:57 p.m. This is Dr. Guido David of Pinoy Scientist on DCEC, Radyo Agila, 1062 Mega Manila. Until next Sunday, stay safe, everyone, and we'll see you again. Thank you.